Hello, my name is Bill Tomlinson, and I'm with Professional Training Associates. In cooperation with the district, we put together the following presentation on basic risk mitigation practices that we can use personally in our daily lives, as well as those specific to the safe reopening and continued safe operation of the schools. Following the presentation, or at the end, I'll present you with my email address. Please feel free to contact me if you have any questions. With that being said, I'll begin the presentation. There are 5 different versions of this presentation based on the occupational discipline in the schools. This presentation is specific to teachers and substitutes. And before I get into the basic risk mitigation practices, I just want to give a little bit of background on the virus and the disease. So, the virus is known as the novel coronavirus, or SARS-CoV-2. It's called SARS-CoV-2 to differentiate this virus from the SARS virus that was responsible for the epidemic back in 2003. That was the SARS coronavirus. This is the SARS coronavirus 2. If you look at on the left of your screen there, you see a photo illustration from the Centers for Disease Control of the novel coronavirus. Now, it's called a coronavirus because of its helical shape. And coming out from the surface, we see these club-like protrusions, commonly called spikes. And these spikes consist of a protein. And this protein allows the viral particle to bind with certain receptors on the outside of cells. In this case, it's the ACE2 receptor on these specialized cells in the respiratory system. Now, the binding with the receptor allows the viral particle to essentially download its genetic programming information into the cell, informing the cell how to replicate the viral particle. This process damages the cell and commonly kills the cell. And that is what we experience as the disease COVID-19. Now, the disease COVID-19 is named to differentiate it from COVID, the disease caused by SARS exposure back in 2003. So COVID-19 for the year 2019 in November when it was first observed. Now, since November 2019, it has spread to every country in the world and every continent with the exception of Antarctica, at least the last time I looked. Now, looking at our numbers here in the United States, we have the highest number of reported cases, currently over 5 million. I looked at Pennsylvania's specific data back on August 3rd, and we had 800 daily cases. Now, that was down from July 23rd when we had 1,185 cases. So we could be plateauing or even decreasing in our case rate, which is good news. Now, another number I want you to think about is the rate of transmission, or what's commonly called the R0 value. And the number is 1. If your number is 1, your R0 value is 1, that means for everybody who has the infection, they're likely to infect one other person. So you have transmission, but you don't have the conditions for an outbreak. If your number is higher, say 3, for every person that has the infection, they're likely to pass it on to 3 other people, and we have an outbreak. Early on in the spread of this pandemic, that number, the median number, was 5.7. So here in Pennsylvania, our R0 value is 0.98, less than 1. So as time goes on, if your number is less than 1, one person is not likely to infect one other person. They'll infect less than one other person. So over time, the virus will die out. Now, we need to get that number below 0.98 to really have control of this virus. but the trend is looking good for us currently. Now, before I get into the actual physical risk mitigation practices, I want to talk about administrative controls. And one of the administrative controls to control this pandemic is paying attention to what's going on in your community, both state and your local community. And we have two resources for that. The first resource is the Allegheny County Health Department. The health department maintains a dashboard, which is a map of the county with all the political subdivisions. So you can mouse over a particular neighborhood and you can see the number of tests that were conducted, the positivity rate, the reported cases for that area. And you can see what the trend is. That is important information to know. Now, you can look at it statewide as well through the PA Department of Health. They maintain a dashboard as well. And you can get Allegheny County specific data out of the state dashboard. However, you don't get the granular detail that you can get from the health department. So the health department's dashboard is an excellent resource for our circumstances in our local area. Now, another important aspect of risk mitigation is self-diagnosis, not going to work when you're sick. So there are three core symptoms of COVID-19: fever, cough, shortness of breath. Those are screening symptoms. So you'll be asked to self-diagnose in the morning for any one of those three symptoms of fever, cough, shortness, and breath. There are other symptoms. You can see there on the screen: fatigue, muscle, body aches, headaches, sore throat, congestion. Those are pretty generic symptoms. Now, new loss of taste or smell, that's pretty specific to COVID-19. But most of the symptoms are generic and they're not good screening tools. So we stick with the core: fever, cough, shortness of breath. Now, before we go further into risk mitigation, I just want to look at this model here. It's called the chain of infection. It's a standard model tool used in epidemiology to explain transmission. And I'm not going to go into each individual link. What I want to focus on is the link at the bottom: transmission mode. And it's called the chain of infection and illustrated as links in a chain, because it's, as the old saying goes, a chain is only as strong as its weakest link. So the exercise here is to identify the weak links and then break them. And if we can break them, we break transmission. So these risk mitigation practices I'm talking about are all about breaking transmission mode. And we have four available to us: respiratory etiquette, masking, distancing, and hygiene. If we employ all four of those tools, and really the only tools in the toolkit, we can effectively break or severely weaken the link for transmission mode. Now, as far as the coronavirus and the disease COVID-19, the spread of it, it is thought mainly to be spread from person to person through respiratory droplets. And when I say respiratory droplets, I'm talking about these larger droplets that come out usually through coughing and sneezing, but sometimes talking or singing. Sometimes they're visible in air. They're 20 microns to 50 microns or even larger. Now, these respiratory particles, due to their size, don't stay airborne very long. They're not buoyant in air. So they'll come out of air, fall out of the air somewhat quickly, but they could come into contact with surfaces, touchable surfaces, and we need to be concerned about that. Now, there's another type of respiratory droplet called a microdroplet. And microdroplets pertain to airborne transmission. A microdroplet are these really small droplets, less than 5 microns, completely invisible. They get cast out into the air and can be very buoyant and travel possibly great distances in a building. Now, having said that, as those particles travel, not in sufficient concentration, at least that it's thought to cause exposure. So there are three distances I want you to think about: 6 feet, 9 feet, and 12 feet. Now, these distances come from a study done at Georgia Tech back in April. So 6 feet, respiratory particles can come out through talking. And at about the 6 foot, there's enough dispersion where there shouldn't be sufficient concentration for exposure. 9 feet for coughing and 12 feet for sneezing. Now, this is the importance of masking and distancing. Masking itself greatly reduces the distance of travel of these respiratory particulate. We'll see an image in a little bit from the medical journal Thorax, an Australian medical journal, where we actually visually see the travel of these particles and the effectiveness of particular masks. There was an article published in the British medical journal, The Lancet, back in June. I should say the prestigious British medical journal, The Lancet. But they looked at three epidemics: the SARS epidemic of 2003, the MERS epidemic, and our current pandemic, the first 5 months of the pandemic. And what they found was masking combined with physical distancing reduced transmission by 85%. Pretty significant. So imagine if you read a recipe that would give you an 85% certainty that you would never contact COVID-19 if you followed the recipe and made this cookie. Eating the cookie daily gave you an 85% protection against developing the disease. Wouldn't you make and eat the cookie? I mean, I would. It would be irresponsible not to. That is the effect of masking and distancing. These two very simple, readily available techniques to break transmission by 85%. Now, also in that study, when they looked at distancing, now this is combined with masking, when they looked at distancing at 3 feet, not 6 feet, they found when wearing a mask in 3 feet, the chance of transmission was about 3%. Now, inside 3 feet, that went up to 13%. But they found something interesting that I want you to think about. They found that each increase in 3 feet reduced exposure by half. So there was this inverse relationship. We increase distance, we reduce by 3 feet, we reduce the potential for exposure by half. So that is a significant thing I want you to think about. Yes, 6 feet is separation, but always try to maintain as much separation as you can, even outside 6 feet, to further reduce the likelihood of an exposure. Now, one of our primary tools in the toolkit for breaking transmission mode is respiratory etiquette, right? Covering your coughs and your sneezes. And how we do that properly is into the inside of our elbow or into our upper arm. Either way, you want to cover both your nose and your mouth into the elbow or the arm when you cough or sneeze. That effectively stops the transmission of those respiratory particulate. You can also, if you have a tissue, you can cough or sneeze into the tissue, immediately dispose of it properly, and then wash your hands or rub your hands with at least a 60% alcohol rub. Never cough and sneeze into your hand. And that is the tendency of most people. So there is a behavioral practice already to cover our cough and our sneeze with our hand. So teaching and drilling students in the proper methods of respiratory etiquette is essential because it may require a slight behavioral change. So it should be drilled. Also ensure there's an adequate supply of facial tissues in the classroom that the students have access to. Now, the school secretary or main office staff will have extra supply of tissues as well as signage because signage can be important. You can use the signage in the school as a learning aid. Now, we have one of the signs here that's used in the school on hand washing. So, hand hygiene, right? One of those tools in the toolkit. So, it's in 9 steps, and it's a very good visualization of how to thoroughly wash your hands. So, this is a good idea to teach and drill your students using this poster as a guideline for how to wash their hands. What you see on the left is the CDC requirements for hand washing, and you can see it wet, lather, scrub, rinse, dry. In the scrub phase, they say at least for 20 seconds. Now, my problem with that is I'm a person that I like procedures because if you have a procedure, you have something that you can measure performance against. And it's really difficult when you just say scrub your hands for 20 seconds to actually indicate how to scrub your hands. So what I'm going to do right now, I'm going to minimize the presentation and I'm going to give you a demonstration on hand hygiene that comes from the World Health Organization. And they put this procedure together back in October of 2014, I believe it was, during the Ebola outbreak in Western Africa, where they had an issue with mainly untrained healthcare workers transmitting infection, that particular disease transmitted through body fluids, transmitting the disease through lack of hand hygiene. So they use this tool to train those people. And I think it's a very effective tool. I do a lot of infection control training in healthcare for construction. And this is the method that I preach in those classes. So I'll just show it to you here. Okay, so the first thing in any hand washing sequence is we thoroughly wet our hands, palms and dorsum. Once we've done that, we gather sufficient soap to cover both the fronts and the back of our hands. Once we do that, we start to rub our palms and fingers together like so. Now I'm going to go a little quicker than the actual time that you would spend on this process just to demonstrate. But once you do that, then you interlace your fingers and rub up and down that way on the palms. Once you're done, you switch to the dorsum and do the same thing on the dorsum of both hands. Following that, clasp your hands and rub them together, your fingers into the palms. Then take the fingertips of one hand into the palm of the opposite hand and rotate them, making sure your nails are coming into contact with the palm of your hand. And you probably want to have contact of your fingers up to about the second knuckle. You want to do the same with the opposite hand. Following that, I want you to grab the thumb, rotate around the thumb, making sure as you do so, the nail of the thumb is embedded into the palm. Do so as well with the opposite hand. Now, when we're done with this, and this should take 30 to 40 seconds to do effectively. Once you're done, thoroughly rinse your hands and dry them thoroughly. Now, you may need multiple towels to do that. Once you're done, holding the waste towel in your hand, turn off the water at the sink. Still holding that waste towel, you then want to grab the handle of the door and open it. What I usually do is I grab it, I swing it open, and then catch it with my heel. And then I toss the towel into the trash. Now, this is something to think about. You don't want the trash to be too far from the door because these towels aren't terribly aerodynamic and they commonly miss their target. So it's not a bad idea if you can't move the trash to the door to have a second smaller container just for those waste hand towels. And that is hand hygiene, a method of breaking the mode of transmission. So we'll resume the presentation now. Okay, we're going to talk about cloth face coverings now. So, cloth face coverings will be provided as well as disposable 3-ply, the surgical masks as well. Now, there's some misunderstanding about masking. Some people, like this is one of my masks, just a simple cotton mask. People think of them as respiratory protection, like a respirator, a device that is designed to protect you from being exposed to hazardous airborne particulates and other dust, fumes, vapors. That is not what this mask is about. What this mask is about is not personal protective equipment, but people protective equipment. Its sole function is to knock down that respiratory particulate so it doesn't travel far into the air. So, teach and reinforce proper mask wearing with your students. And we'll go over some of the things you want to think about in your instruction with them. And understand that, particularly younger children, it can be difficult to wear a mask all day. They can be uncomfortable. I wear them all day. I do adult education, and there could be lecturing for 6.5 to 7 contact hours a day. So there is a little restriction on breathing, and that can be wearing over the day. So you want to make sure the mask you use has limited restriction in your breathing, particularly if you're going to be wearing it all day. Again, the idea isn't to the more restriction, the greater efficiency of the filter area, and that's not what this is about. It's about knocking down those larger respiratory droplets. So maintain an adequate supply of the disposable masks as replacements. Extra disposable masks will be provided to the classroom, and you will be provided with a cloth mask, though you're encouraged to wear your own from home, like I do. Replace your mask when it becomes wet, dirty, and damaged. For instance, my mask at the end of the day, talking to people, projecting, the mask does get damp. So when I do, I wear alternate masks every day. Every couple days, like I'll wear this mask one day, I'll wear another one the next day. I'll wear this the following day, and then I'll have it laundered. Now, you have to ensure that your students wear them properly. And really, the basic wearing it properly is covering the nose and the mouth. Now, students can bring their own masks in from home. And again, that could be encouraged to maintain adequate supplies in the school. Now, wear your mask at all times when in public spaces. And again, it's encouraged to wear your own so you can take it home and wash and launder it. But replace them when they become wet, dirty, damaged, and then dispose of properly. Operations will provide 3-ply disposable masks, face shields for teachers, and those transparent smile masks for instance, speech therapists. So they'll be in the startup kits that operations provide. And here are just examples of 2 kind of masks. On the left, we have more of the disposable surgical multi-ply mask. And on the right, we just have a common cloth mask, a homemade mask. It is important if you're making your own mask, or even if you're searching for one commercially to use, that it provides multiple ply of material. Single ply masks like a bandana, I mean, a little bit, but they're not terribly effective, and I don't recommend them. So this is from the Thorax, the Australian Medical Journal, where we look at these 3 rows from speaking, coughing, and sneezing, and you can see the amount of respiratory particulate that is ejected. The column to the right of that is a single ply, like a bandana. And you can see there is some reduction in the amount of the particulate. It doesn't go quite the distance out in the air, but it's not great. Now, next to that is a 2-ply cloth mask like the one I wear. And we have a greater reduction in that respiratory particulate, and it's not going as far out into the air. It's kind of hanging in front of us. The last column is the 3-ply surgical mask, and you can see even the greater reduction in the ejection of respiratory particulate. Now, again, it's not designed to protect us from inhaling viral particles, though it could reduce the concentration of that, but they are not efficient respirators at all. And here are some criteria for mask wearing. So you want, and I'm going to demonstrate that. So you want it to fit over the nose and mouth and fit snugly around the face, but be comfortable. If it's not comfortable, people aren't going to want to wear it. Secured with ties or bands or ear loops like mine. Include multiple layers of fabric, usually 2 of a higher thread, mid-thread count, 200 to 300. You get too tight of a thread count, you're going to get too much restriction and you're not going to be able to wear it. Can be laundered at the warmest temperature suitable for the fabric, and then not used if they become wet, dirty, of course, or damaged. So I'm going to minimize the presentation. I'm just going to show you basic mask wearing using my mask. So here's my mask. It's a 2-ply, I think it's a 300 thread count cotton with 1/8-inch elastic bands for earlobes. So essentially, if you have a disposable 3-ply mask, a pleated mask, as some cloth masks are as well, you want to extend that out first before you put it on. I commonly see people do that, and then they kind of open it up. So you kind of want to open it up if you have the 3-ply mask for this type. You want to get your fingers through the loops, and then you want to start at your chin and just put it up. And then take your bands and put them around your ears, make sure they're comfortable. And then you want to move the mask up, if you can, as high as you can on the face. And then use your fingers to form it around. So there should be a somewhat semi-rigid tab here that allows you to do it. When my wife was first making those, she took just craft pipe cleaners and wound a couple together, snipped them off, and it was fairly effective. They maintain their shape. These are more the metal tabs you would find on a N95 respirator. But the mask should seal comfortably, but somewhat snugly to the face all the way around. We don't want gaps. Sometimes pleated masks can leave a gap like that, where you have a pathway for respiratory particulate. So you want it to be in contact with the face, but again, comfortable. You may be wearing these for a while. I said I wear them all day. So to take it off, you just reach your fingers through on this particular style of mask, and then you have it. Now, one thing I want you to be aware of, you should never touch the front of the mask. So for instance, wearing it, kind of grab it like that or take it off. Now, it's just industrial hygiene practice, right? If there's any contamination on the outside of the mask, we don't want to transfer it to our hands. So probably not a big deal. Again, these are not respirators, and we're not expecting this incredibly high concentration like you would if you're in an environment where you'd need a respirator. But you just want to, as a certain practice, try not to touch the front of the face piece. So just lay it down. What I do in my office, because masks always worn in public, except if you're seated alone with no one else. So what I do when I'm in the office is I usually just leave it hanging on my ear like this. And then if something happens, I bring it over and I'm ready to go. Somebody enters into the office. So it's pretty much hanging. If not, I'm wearing it. It's hanging off me all day. So we'll go back to the presentation now. So now we're on to social distancing. So masking and social distancing are 2 big tools. Remember, used together can break transmission mode by about 85%. So, social distancing, the common term used for it, is more physical distancing, right? Because we need to be physically distant, but yet socially connected. So, I typically just call it distancing or physical distancing versus social distancing. And there are those distances I want you to think about 6, 9, and 12 feet based on what's going on a cough, a sneeze, or just talking or singing. Now, sometimes physical distancing isn't practical. You can't maintain 6 feet. Well, in those cases, you want to limit your interaction to less than 15 minutes. Public health guidance says that 15 minutes or more within that increases the risk of exposure. Now, in the classrooms will be set up by plant operations in accordance with a physical distancing toolkit that is provided to the principals. You will be involved in that, giving your input as far as where your desk is and where you need to travel in the classroom so we can set up social distancing properly. So you'll have at least a 6-foot perimeter around your desk. Now, this is saying that social distancing is great, but it needs to be practiced in combination with those 4 tools or 3 other tools that I just talked about. Now, when we're talking about transmission or respiratory particulate, I said, yeah, sometimes things fall out of the air and can come into contact with surfaces. We mainly focus on highly touched surfaces, or what we call high touch surfaces. So what I'd like you to do is keep an inventory of what you touch during the day and then wipe them off periodically. Always remember to think about your mobile phone. When we were back talking about the chain of infection, one of those links was the reservoir, essentially the host environment for the microorganism. And cell phones are amazing reservoirs for microbial life. So don't forget about those. Now, organize existing supplies in the classroom. The pre-K through 5 brick and mortar students will be provided their own supply kits. So make an inventory of those frequently touched surfaces. Include items, again, like your phones and tablets. And sanitize, you'll be provided with disposable wipes. Sanitize your desk and other high-touch surfaces prior to any other teacher's use. Operations will provide an adequate supply of those disposable wipes. Now, using those disposable sanitizing wipes, there are no PPE requirements like gloves and goggles. Minimize sharing those objects with other teachers, right? So just keep that inventory, wipe that inventory down, and try to limit the amount of sharing of objects with other teachers. And then, of course, discourage sharing of items that are difficult to clean. We have irregular surfaces and so forth, or the surface itself may become porous. You want to be mindful of that. Keep each child's belongings separated from others and in individual label containers, cubbies, or areas like that. And then ensure there's an adequate supply to minimize sharing of high-touch items. As far as electronic devices go, you want to avoid sharing those. Each student should have their own device that will go home with them at night and then return to school the next morning. Now, as far as textbooks, establish protocols designating a place for used books that will be sanitized by the custodial staff. Now, I just want to briefly talk about cleaning and disinfection. So, cleaning is the physical removal of soil from a surface. Now, in doing so, just using a general all-purpose cleaner, you can reduce the microbial loading on a surface just by physically picking it up and throwing it away, but it may not be really effective at killing the microbes that are on the microorganisms that are on the surface. That's where disinfectants are used. And disinfectants are very common in healthcare to break the transmission mode for healthcare acquired infections. Now, the custodians will be responsible for disinfection of the schools, and they will use only chemicals that are approved by EPA. EPA maintains a list of approved chemicals for the coronavirus called List N, and you can find it at epa.gov/List N. Now, you may want to wear gloves. So if you do want to wear gloves while you're using disposable wipes, I just want to show you a quick procedure, my last demonstration on how to remove those gloves. Now, if you've ever had first aid training, you've probably learned a procedure very similar to what I'm going to show you. Now, to do this, I'm going to have to first put on the gloves to remove them properly. So I'm going to minimize the presentation and put on the gloves. Okay, so here are my gloves. These are just standard non-powdered vinyl examination gloves. For the demonstration, I got extra larges to make this. I always have a problem putting on gloves. Now, whenever you're putting on the glove, you want to make sure the sleeve is extended as far as it can be down the wrist. So these gloves are very common and readily available. So once I get the glove on comfortably here, okay, we can begin. So the sleeve, again, you can see is extended. Okay, so when you're done, the whole idea of this, what we call a doffing procedure, taking off these gloves, is to prevent any chemical residue or contamination from being transferred onto your skin. So to do that effectively, what I want you to do is with one hand, grab the other hand at the wrist, between the wrist and the palm. And what you want to do then is grab it and pull it off the hand, but not completely. You want to turn it inside out till it's just past the fingertips. Now with that, you want to grab the other glove between the wrist and the palm, and you want to pull that glove completely off, turning it inside out. Now with that glove in your hand, you want to grab the opposite glove and completely remove that. So now we have two gloves completely inside out. We've contained the chemical residue or particulate contamination on the inside, and we've stopped it from being transferred onto our skin. Then, of course, we just properly dispose of the glove. Now, it's not a bad idea to always, if you have access to a 60% alcohol rub, just to rub your hands after that. Okay, we'll go back to the presentation. Now I just want to talk briefly about public health guidelines. There are two agencies that we look at. The first is the Centers for Disease Control. Centers for Disease Control have guidelines out on the safe reopening of the schools. But more specific to our area, the PA Department of Health, which mainly mirrors CDC guidelines, but they have specific guidelines to the state. So Plant Operations and Health Services Department regularly keep an eye on those guidelines for any changes. If there are changes, they update the school's safety plan accordingly. So it's always current. So you can look at the safety plan as this living document that is changing as the guidelines change. And now we're here at the end. So what I want to do is I want to give you my email address there. Again, my name is Bill Tomlinson, and my email is btomlinson@ptainc.com. So if you have any questions or comments, please feel free to contact me. And with that being said, we're at the end of the presentation. I hope you found some valuable information. And again, contact me if you have any questions or comments. Together, we can work to provide a safe reopening and continued safe operations of the schools. Thank you so much for viewing.